On July 4th, 2025, President Donald Trump signed H.R. 1, commonly referred to as the Big Beautiful Bill, into law, a sweeping overhaul of federal safety net programs. Backed by congressional leadership, the law combines deep tax cuts with major changes to Medicaid, food aid, and rural hospital funding, the largest social policy shift in decades. The law imposes work requirements on Medicaid, trims disability and nutrition benefits, and slashes federal health spending by over $1 trillion. It promises self-reliance, a bootstraps mentality to America's problems. But in Appalachia, where hospitals are closing and the number of people in need of care is high, it threatens to widen an already deep health gap. For Appalachian people, this is not new. It's the latest turn in a long cycle. From the War on Poverty's clinics and food programs to the 1990s welfare reform, mountain families have seen safety nets built up and torn back down for generations. Central Appalachia's health crisis runs deep. Overdose, suicide, and other diseases of despair strike at rates 37% higher than the rest of the country. Residents here also face a severe provider shortage, about 65% fewer specialist doctors than the U.S. average, and often must drive hours just to reach basic care.
I graduated in 2005 from UVA-Wise with a Bachelor of Arts in Communication. After that, I entered the work field and remained in the work field until I was medically disabled 5 years ago. I had a autoimmune liver disease, which then led to liver cancer. The liver cancer was treated and resolved, and then in October of 2024, went into respiratory failure, was sent to UVA in Charlottesville, where I was in a coma and subsequently had a liver transplant. I'm a Medicaid recipient. I'm also on disability and receive SNAP benefits. These are things that sustain my life.
In 2018, Virginia finally expanded Medicaid, extending health coverage to over 400,000 low-income adults statewide. Advocates called the expansion a godsend from the very beginning, one of the most impactful health reforms in state history. For patients like Tiffany, access to Medicaid means the difference between life and death. The Big Beautiful Bill reverses a decade of Medicaid gains. It adds work requirements of 80 hours per month, caps funding, and shifts coverage costs to states. These changes are projected to cut $326 billion nationally and drop coverage for hundreds of thousands in Central Appalachia.
I don't know about anyone else, but I spent 24 years as an active drug addict, and I never got offered drugs from a stranger. Anytime I ever got drugs, it was from somebody I knew. It was never from a stranger. You know who did give me drugs? My friends, my relatives.
My doctor.
The people that's supposed to care and love for me and protect me. But, the majority of those are legal. So what makes one better than the other?
I did the doctor drugs. I did the fancy pinkies out drugs.
Yeah.
So I couldn't do meth. I had to have Adderall because it made me better, right? Like I was better than the person using meth because mine came, I don't know.
Bougie-ass drug addict.
But I'll tell you this, like I maybe did my drugs with my pinkies out and you didn't, but we sure did end up in the same rehab, didn't we? But the thing about our rural areas where we live is that the majority of our people have Medicaid coverage to cover their health care. It's not a small fraction, it is a majority of the people in Eastern Kentucky, and Medicaid, as far as substance use goes, covers all of that substance use treatment, whether that's residential treatment, outpatient treatment, MOUD, and medications and those things like that. So it doesn't have a drastic impact.
Kentucky expanded Medicaid in 2014 and embraced an all-hands-on-deck approach to the opioid crisis. Today, it leads the nation in addiction treatment capacity, about 70 recovery beds per 100,000 people, more than double the rate than neighboring Appalachian states like Ohio, West Virginia, Tennessee, and Virginia. Eastern Kentucky is finally seeing overdose deaths decline. 14 of the 20 U.S. counties with the sharpest drops in overdose mortality were in eastern Kentucky. Estimates show that more than 1.6 million individuals with Medicaid receiving treatment for a substance use disorder would become uninsured. This would cut off access to life-saving care, including therapies, medication-assisted treatment, and some forms of naloxone, which can reverse opioid overdoses. In Kentucky alone, 102,314 adults enrolled in Medicaid received treatment for a substance use disorder in 2021. Medicaid covered almost 60% of national spending on these treatments.
The range of estimated people who will be impacted negatively, as in losing their Medicaid, in the state of Virginia, the range is 161,614 to 322,000 individuals. The estimated number is 206,000 people will lose their Medicaid, and an additional 147,000 people will face copays of up to $35. $35 doesn't seem like a lot of money. One thing that you should keep in mind is that some people with Medicaid, a lot of people with Medicaid, are below the poverty line, and $35 is a huge deal. So when you have the choice to feed your kids or pay $35 for a copay, you're likely not going to go to the doctor, when probably you really should.
Not having access is a huge issue that I hope everyone in our Commonwealth is going to rally around and rise up behind, because no one should be denied access to health care. Everyone should have robust access to the fundamental ability to be cared for. We should not be experiencing cuts, we should be experiencing care. And taking away 35 hospitals is the antithesis of that. That is not what a Commonwealth is. A Commonwealth means we take care of the common good, and that means all of us.
Also, as a result of people losing Medicaid, that I don't think a lot of people take into consideration, are the closings of hospitals, losses of job, quality of health care that other people will receive. So maybe you're not on Medicaid. Maybe people losing Medicaid is not a big deal to you. But if there's a large percentage of people in your area on Medicaid, which in Virginia there are, then hospitals are going to close because people are not going to the hospital because they no longer have health coverage. So with hospital closing, you go to the ER, there's one hospital in your area for a 35-mile range. You're going to wait a long time to be seen by a doctor. More severe cases are going to be pushed ahead of yours. So you might not be bleeding to death, but you're going to be in pain for a long time in a waiting room of an ER.
Across rural Appalachia, hospitals have been disappearing. The UNC Shep Center has documented 138 rural hospital closures in the U.S. since 2010, many of them in coal country. In far southwest Virginia, Lee County's only hospital shut its door in 2013, leaving residents dangerously far from emergency care when every minute counts. According to the National Rural Health Center, local hospitals will lose approximately 21 cents out of every dollar they receive in Medicaid funding due to the Big Beautiful Bill. Total cuts in Medicaid reimbursement for rural hospitals and national and state funds over the 10-year period outlined in the bill would reach almost $70 billion for hospitals in rural areas.
You know, we need to stop taking from folks here and start helping the folks here. Kentucky has one, or Appalachian region in general has one beautiful resource left, and it's people. And that's, they haven't killed them off yet. they haven't worked them to death. But damn it, they're trying. But we have one resource left, and it's our people, and we have to protect that.
So my inspiration to people would be to stand up on the floor and to say, we don't have to accept this. We deserve better than this. There are alternatives. There are other ways to care for one another. We can make sure that everybody who wants housing is housed. It's possible. There's no reason why people shouldn't be able to get to jobs because public transportation is so severely underfunded. We could fully fund public transportation and make sure that people can get to jobs. We can make sure that people have access to higher education so that the folks who in Harlan County, Kentucky, when I was sitting on those railroad tracks when they were protesting, were talking about what they'd like to do once they got what they wanted, which is justice, which is to be paid for their work, could go pursue a higher education. That's what they wanted to do. They were like, we want to trade, we want to go to tech school, we want to do something with our lives and with ourselves. Well, instead of cutting higher education, instead of cutting loans, you need to make it more accessible. That's what you need to do. Stop talking a good game or what you think is a good game and actually show up for people.
We are going to make it through this. I know that there are people who are stressed. There are people who are afraid. There are people who are concerned. Lean on the people around you. Lean on your community work groups. Lean on each other. Hold each other up. We're going to get through this. I know that you are probably discouraged right now. I challenge you to turn that discouragement into a voice. Reach out to your representatives. Let them know that we do not stand by this big nasty bill. We do not stand by it. As Virginians, we do not want it. Your voice is being heard, so reach out to them. Educate each other. Support each other. Provide each other with toolkits. Do everything that you can to stand strong hand in hand to survive the times that we are facing.
As of 2025, 10 states still reject Medicaid expansion, leaving an estimated 1.4 million low-income adults with no affordable insurance in this coverage gap. Research shows that Medicaid expansion has already saved roughly 27,000 lives in a 12-year period, and 1,000 more deaths could have been prevented if every state participated.
I realized that my liberation is caught up in theirs, and theirs is caught up in mine. I will never be free from the things that oppress me unless and until I am actively working toward the liberation of somebody else. And that is a human fact of life.
I'm going to tell you now the way that we don't do this. We don't go talking at people. We don't go talking down to them. We don't go making them feel less than. If you want them to do better, be better, we have to be better.
We need to look at one another as people who can teach. We can teach one another across the Commonwealth. And in that teaching, we can build collective power and say, okay, so now here are some tools that we have that we can collectively use to say to DC, we're not going to stand for this. You've written Kentucky off. That's what the national landscape thinks about our Commonwealth. So what we need to do is come together and say, oh no, you will see us and you will hear us. And we need to use our voices and our powers to say no more to this. Just like we defeated the prison in Letcher County, we're going to defeat every single piece of legislation that is designed to destroy, to hurt, to really to kill. That's what it's designed to do, because so many people are not going to be healthy and safe because of this bill.
Out here, where the big jets just fly over and leave the blue skies colder, while passengers hold magazines and look down from their shoulders. We're looking for something to lift us up, but one thing's real clear. We're being held down by our bootstraps out here. We're being held down by our bootstraps out here.
Eternal, ever-blessed God, help our senators to walk on your path for the glory of your name. Help them to walk with humility so that they will strive to be servants of the people. Help them to walk with forgiveness so that they will forgive as they desire to be forgiven. Help them to walk with courage so that nothing will deflect them from the way they ought to take. Help them to walk with endurance so that nothing may daunt or discourage them until they reach their goal. Lord, help them to walk with loyalty so that nothing will ever seduce their hearts from their devotion to you. We pray in your loving name. Amen.
So I want to start with calling this the big bad budget bill, right? Or the bad budget bill, because I believe there's power in language. And so when we call it what they call it in DC, we give it power. And I don't want to give that power to it because it is a federal tax cut bill and budget bill. That's exactly what it is. And so it's ugly and it hurts our urban, rural communities alike. And so there's an opportunity for us to collectively build our political power in those areas across Kentucky to say, no, we're going to push back against that. We don't want it locally. We don't want it statewide. We don't want it federally. So it's decades in the making. It's not new. It should not be a surprise to anyone that we are here. I hope no one is asking, how did we get here, as people often do, or this is not us. This is exactly us. How do you think this country was founded? It was founded by colonization, stripping land and taking property away from the indigenous people here. You did the same thing to Black folks when you used us for chattel slavery. And then you take Appalachia and you strip it of all of its natural resources and you take away job creation, employment opportunities, educational opportunities. My goodness, the power we could build if we came together and said, across those geographic differences, we're going to stand up against our elected officials who are trying to destroy all of us.
What keeps me up at night is the loss of the hospitals here in the region. You know, the projections that we hear from the hospitals themselves that they're going to have to close down. And even if people do have health care, even if they didn't personally lose their health care, they're not going to have doctors or hospitals accessible to go to. And that's terrifying to me, especially for a region where we still have active coal mining. There are big accidents that happen in mines regularly throughout the year. We see those pop up in the news all the time, and to not have a hospital to go to in a situation like that is just is devastating. I think from an individual level, we'll see people losing their insurance. We'll see insurance rates go up, cost of healthcare go up, and people in this region can't afford that. And losing access to hospitals means losing out on job growth opportunities as well, because who wants to move to an area where the nearest hospital is 2 hours or 3 hours away?
My medical issues began to get severe with liver issues. I had a autoimmune liver disease, which then led to liver cancer. The liver cancer was treated and resolved, and then in October of 2024, went into respiratory failure, was sent to UVA in Charlottesville, where I was in a coma and subsequently had a liver transplant. I'm a Medicaid recipient. I'm also on disability and receive SNAP benefits. These are things that sustain my life because due to medical issues, I am on disability. The estimated number is 206,000 people will lose their Medicaid, and an additional 147,000 people will face copays of up to $35. A lot of people with Medicaid are below the poverty line, and $35 is a huge deal. So when you have the choice to feed your kids or pay $35 for a copay, you're likely not going to go to the doctor, when probably you really should.
The thing about our rural areas where we live is that the majority of our people have Medicaid coverage to cover their health care. It's not a small fraction, it is a majority of the people in Eastern Kentucky. And Medicaid, as far as substance use goes, covers all of that substance use treatment, whether that's residential treatment, outpatient treatment, MOUD, and medications and those things like that. So it is going to have a drastic impact on Eastern Kentucky specifically.
It's going to have a devastating impact on just the way that programs are ran. You're already seeing programs starting to shut down now just because of the cuts coming. They're not even here yet. They haven't even started yet, and you're already having programs closed down because they're not going to be able to get reimbursed. Right now, Kentucky has this saying that we lead the nation in recovery beds per capita. Well, that's about to change. Yeah. We might still lead it in per capita, but they're going to be so hard to access that there's going to be a 2-year waiting list, and then we're just going to have people dropping like flies. We need to stop taking from folks here and start helping the folks here. Appalachian region in general has one beautiful resource left, and it's people. And that's, they haven't killed them off yet. they haven't worked them to death, but damn it, they're trying. But we have one resource left, and it's our people.
All of these issues are connected. When we cut SNAP benefits, we're cutting them from people who are pregnant, for example. So we know that 1 in 4 Black women rely on Medicare, for example, right, or Medicaid. And so to cut SNAP benefits means that you're cutting benefits for people who need it the most. From our kids, from our future. You're cutting it from people who are trying every single day to make ends meet, sometimes with nothing. With absolutely nothing. And so they're relying on at least something that allows them to feed themselves and their families. To me, it's immoral to cut access to food. I'm laughing to keep from crying, as Langston Hughes said. It's not funny at all. There's nothing hilarious about it. It's actually painful. And it's going to be real pain when babies' tummies are growling from hunger. When people are so hungry they can't even think straight. How can you concentrate in a classroom if you haven't eaten the night before? We're setting our country up for failure, and Kentucky's being set up for failure. $12 billion? Kentucky's not going to be able to afford a $12 billion responsibility for what the federal government is cutting. We're already not doing a good job taking care of our people.
People have in the front of their mind, I don't have Medicaid. I don't receive SNAP benefits. If SNAP benefits are cut, people are not going to buy food as much. What happens when people don't buy food as much? First of all, it's horrible that a child would go hungry, right? Nobody thinks that's cool. And that's what cutting SNAP benefits means. It means that there are children in our area, your neighbor's kids, are going to go hungry. Almost half of the children in Lee County, Virginia, receive SNAP benefits. That means they eat because of SNAP benefits. So not only are your neighbor's kids going hungry, your prices at your grocery stores are going to skyrocket because they still need to make their money. Therefore, if someone isn't going to the grocery store, if 50% of these parents in Lee County are not going to the grocery store, then your grocery prices in Lee County are going to go up because they have to make up for that loss. It's when you think about it logically, not just from the emotional side of children need to eat, right? But if you think about it logically, this bill will impact everyone.
There's so many parallels that we experience in Kentucky, whether you're in Eastern Kentucky, Letcher County, or you're in urban Louisville, in the west end of Louisville, where so many of my family members and friends live. There are so many parallels, whether it's what we're experiencing with lack of access to health care in the west end to lack of access to health care in Eastern Kentucky. I mean, We've got one hospital in the west end of Louisville. We've got 50,000 people. So, that's significant. That's something that we should be talking about. When I think about the west end of Louisville being what's been called a food desert, a lot of folks now talk about food apartheid. I think about Eastern Kentucky and how far people have to go to get to a grocery store. Come on now. But yet in the west end of Louisville, there are more fast food restaurants per capita than anywhere in the Commonwealth of Kentucky. So you're poisoning us with all this fast food and don't even think that we need access to healthy food. Same thing's happening to our siblings in Eastern Kentucky.
So we've actually, ever since the Republicans kind of swept the House, Senate, and presidency in the elections in November, we kind of knew this was coming. Anytime one of the parties has a trifecta like that, they use this reconciliation process, and we really weren't all that surprised at what we saw in those bills because the Republicans have been projecting what they were going to include. I think what really caught us off guard was just the how far they went with everything. And so, one of the things that we knew that they were going to go after were all of the various clean energy and environmental justice programs that the Biden administration had enacted and that the Democrats had enacted when they had a trifecta. So we knew that was all coming. I think there's still some uncertainty about how that will all play out.
Yeah. I mean, the real tragedy of Appalachia's history is that its economy and its way of life typically is based on things that happen outside of Appalachia. The lumber industry, the coal industry, when those things go away, Appalachia has nothing to cope with it. And since the 70s, one of the things it has relied on is government funding for its health care, for major companies, for major infrastructure. And without those things, it is, I think, really difficult to imagine how Appalachia continues to function in the way it does. And this is on top of the decline of the coal industry, which I think the region has really struggled to replace. And I don't think Appalachia is prepared for the withdrawal of federal money that the Big Beautiful Bill will achieve. And I think in 3 years, when a lot of this goes into effect, we're going to see some serious economic issues emerge, especially in healthcare, but also in infrastructure and all these other things. How Appalachia moves on from this, I think it's a real open question how Appalachia moves on from most of its problems. I think part of the answer has to lay in a recommitment and a rediscovery of Appalachia's culture, of the things that make Appalachia uniquely and beautifully Appalachian, and somehow applying those to the economy. But that relies on sort of Appalachians being able to move past the collapse of these things, both emotionally but also some ways economically already, I think.